Hey everyone, welcome back to Parently. Dr. Mark Boyd here, and today we're going to try to identify whether you are a low-risk patient for pregnancy or a high-risk patient for pregnancy. Now it's important to understand why we're stratifying you into these different groups. The most important reason for you as a patient is if you fall into one of these high-risk groups, you need to plan on seeing the doctor more frequently, potentially ending up on bed rest, potentially ending up in the hospital. And lastly, the most important issue is, am I going to have to be delivered early, either by induction or by cesarean section? These are all very important financially. These are all very important as far as your job is concerned. This is all very important as it relates to other family members, meaning specifically your husband and other children. Now, low risk pregnancy versus high risk pregnancy. Most important thing to understand is most women that are pregnant are low risk. It's important to understand, even if you're a low risk patient, that you can become a high risk patient during your pregnancy, and it's important to understand what that means. We're going to specifically talk about what defines a low risk patient versus a high risk pregnant patient at the beginning of the pregnancy. This is not a complete list, but these are identifying factors that your healthcare provider will look at when he or she is talking to you. The most important issue in today's medical world is obesity. Obesity is now the #1 risk factor for all healthcare problems in the United States. Obesity is defined as a BMI of greater than 30. Now, do you fall into that category? Well, get on a scale, weigh yourself, measure yourself as far as your height goes, and you can establish whether your BMI is greater than 30. You just get online, plug in your height, plug in your weight, and you will be assigned a BMI. Body mass index of greater than 30 is defined as obese. BMI of greater than 35 is defined as morbidly obese. BMI of greater than 35 increases your risk for hypertension during your pregnancy. It increases your risk for diabetes during your pregnancy, and it increases your risk for needing a cesarean section because your baby's grown too large during the pregnancy and you're unable to deliver vaginally. So obesity is the #1 risk factor, again, in today's medical world for establishing whether you're low risk or high risk. The second category is previous medical problems. Specifically, do you have hypertension? That means elevated blood pressure. Are you on medication for your hypertension or are you not? Do you have diabetes or do you have prediabetes? Going back to category #1, if you're obese, you have an increased risk for having diabetes and not necessarily knowing that. But when you're obese, you're also at increased risk for developing gestational diabetes. That means diabetes during your pregnancy. Other issues that would fall into the medical history would be a woman that has had a previous history of cardiac issues or heart problems, a woman that's had kidney problems, a woman that has autoimmune problems. All of those are going to place you into a high-risk category. The third issue that we look at as far as high risk and low risk is your age. Women that are less than 16 and greater than 35 have an increased risk for pre-eclampsia during their pregnancy. Now, pre-eclampsia, women have heard that term before. Maybe your mother said toxemia. It's all of the same problem. It means 3 things. It means you have elevated blood pressure, it means you spill protein, and it means you have swelling. Those 3 categories make up the definition of preeclampsia. There's a mild form and a severe form, but each patient less than 16, greater than 35 has an increased risk for developing preeclampsia. The fourth issue, not always known when we start the pregnancy, is a woman that has more than 1 baby. So a woman that has twins or a woman that has triplets or quadruplets. In today's world with in vitro fertilization, women oftentimes will have multiples, and that means 2, 3, or 4 babies or more. That woman automatically ends up in the high-risk category. The last issue that we look at is your previous obstetrical history. Your previous obstetrical history is very, very important for your healthcare provider at the onset of your pregnancy to know whether you're at high risk. And I'm going to look at the patient both at the beginning of your pregnancy, the middle of your pregnancy, at the end of your pregnancy, last pregnancy, and the pregnancies before to establish whether you fall into this high-risk category. And I'm going to give you several examples. If you've had a pregnancy loss, in the middle of your second trimester, that means somewhere between 18 and 25 weeks, and had a pregnancy loss where your baby just was delivered vaginally, you may have what's called cervical incompetence. That would be a patient that would need a cerclage during your pregnancy, and you would be automatically placed in the high-risk category. The second patient would be a patient that delivered really, really early in her pregnancy. For example, she had a preterm delivery as early as 24 weeks, all the way up until 36 weeks. So any woman that's had a preterm delivery, whether it was vaginal delivery or cesarean section, you're at high risk for that happening again. So you would be placed in the high risk category. The next patient would be a woman that's had a stillborn. That means a baby that's died in utero sometime during her pregnancy after the 24th week. She would be at increased risk for having that happen again, and she would be followed in a closer manner than somebody that has not had a stillborn. The last issue is a woman that's had a difficult delivery, whether it was a vaginal delivery with forceps, a vaginal delivery with a severe tear, a cesarean section that required a blood transfusion, a lady that had a blood loss that was significant after her delivery where she required a blood transfusion. All of those patients would be defined as a high-risk patient as far as her obstetrical pregnancy this time is concerned, and she would be monitored closer, especially as she got closer to the end of her pregnancy. Now, it's important to understand, this is not an absolute list. This is a general list, but it needs to be known, these facts need to be known early in your pregnancy so that your healthcare provider can establish whether you need to be seen by somebody else. And I'll give you a couple of examples. So if you're being taken care of by a family doctor or a nurse midwife and you have any of these high-risk issues, you need to be referred to an obstetrician gynecologist and or a maternal fetal medicine specialist. That's another name for what's called a perinatologist. So in a high-risk pregnancy, you should be taken care of by a board-certified obstetrician gynecologist in conjunction with a perinatologist. Very important that you establish that early on. That's it for today. We'll see you next time.